I would like to address the aging of my under eye area. Tried filler and left it lumpy. What are my other options? I have thought about peels and/or laser treatments, but wonder if surgery would be the better route. I have had filler a few times and have been unhappy the last 2 times. Seemed lumpy. Skin definitely seems to be getting looser in my under eye area. Any suggestions would be appreciated.
Thank you for your question. You submitted your question with a photo, and you are asking basically how best to treat the aging changes of your under eye area. You describe in the details of the question that you have been unhappy with the last 2 times you had filler placement because it left you the area looking lumpy, and in addition you are concerned about the skin getting loose under the eyes. Well, I can certainly share with you my approach to patients like yourself who come to my practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping under-eye aesthetics with a wide range of strategies and techniques, including surgery, lasers, and injectables, has been the cornerstone of my practice throughout my career. And I can certainly help you appreciate the strategies and what the logic behind the strategies are. So to begin with, there may have been a point where you had noticed some relative hollowing that seemed to be amenable to the placement of fillers, which is why you were doing that. And essentially what has become a very significant option for many people who are experiencing something called lower eyelid fat prolapse, which means the formation of these under eye bags due to the fat from around the eyelids pushing forward, is to place an injectable filler in what's called a tear trough. And it is certainly a strategy that I employ pretty much every day in my practice to help patients who want to look good for an upcoming event, or recognize that they're going to have surgery or want to have surgery but they don't have time. And essentially the strategy is also contingent upon the level of prolapse of this area of the fat. But what's also important, and I think you have discovered, is the tissue quality. When the skin is thinner, then the strategy of using a filler becomes a little bit more complex because the skin can become, as you have observed, lumpy. What I would say is that when I look at a patient and evaluate their eyes, I also look at the whole picture. I look at the whole face. And I think it's important you take that perspective to understand that facial aging is not limited to just the eye area, but look at how the global facial area is impacted. In particular, I would say notice the cheeks. A lot of times people are focused in the narrow zone of the areas of their eyes and don't realize that cheek volume has also diminished. So when I do an evaluation, I look at both the eyes and the cheeks. Now, that being said, a strategy can certainly be employed to address the under eye area as well as to address the skin quality. So what is routine in my practice is to do something called transconjunctival blepharoplasty, or lower eyelid surgery, from the inside of the eyelid to address the fat pockets that have pushed forward and have created this contrast between the bulge of the fat and the hollow of the trough, which is where you are having the fillers placed. By addressing the puffiness, the trough does not look as obvious. In addition, we routinely combine this with a strategy of using regenerative medicine technology using something called platelet-rich plasma. Platelet-rich plasma, which is derived from your own blood, helps to stimulate collagen, which is so important to address skin aging, and is very, very useful and helps with both the collagen volume of the skin as well as discolorations and fine lines. In addition, we routinely do something called fractional CO2 laser or fractional erbium laser to help with the epidermis as well as the dermis to help improve the skin quality, to improve some of the perception of looseness. It's very important to understand that the laxity you're feeling is not really representative of excess skin. There's a distinction that is very important to be made, that there's a difference between skin quality and skin quantity. And many times people get in trouble when well-meaning plastic surgeons take away skin in an attempt to tighten the lower eyelid, and which results often in a lower eyelid retraction or ectropion. But we don't have to go there. I think it's important to just recognize the anatomy that's, as I just described, to understand the approach. So meet with qualified, experienced cosmetic surgeons who have extensive understanding of the eye area and discuss the options that may be useful for you, and then see what makes sense to you and move forward. But understand the different elements. There's the anatomy of the fat, the anatomy of the skin, and the anatomy of the face and the cheek that are all very important to have in harmony so that you get a nice outcome. So I hope that was helpful. I wish you the best of luck. Thank you for your question.